Hello friends, myself Dr. Sanjeet Kumar. Today we are going to start one-liner point related to toxicology. Handed one-liner points. So first, garlic smell of poison seen in arsenic, sulfos or white phosphorus. Rotten egg smell of poison seen in hydrogen sulfide. Soup polish smell of poison nitrobenzene. Fishy odor of poison zinc phosphide. Oil of bitter almond cyanide. Cherry red hypostasis seen in carbon monoxide. Brick red hypostasis seen in cyanide. Black color hypostasis seen in opium. Bluish green hypostasis seen in hydrogen sulfide. Sodium fluoride is used as preservative in poisoning of coca. Coca is the mnemonic. Carbon monoxide, cocaine, cyanide or alcohol. Then indication of hemodialysis. Hemodialysis indication blast like barbiturate, lithium, alcohol, salicylate, thiocyanate and theophylline. Then contraindication of hemodialysis ABCD like amphetamine, benzodiazepine, corrosive, digitalis. Then PCT necrosis seen in the poisoning with mnemonic calm like cadmium, acid like oxalic acid and carbolic acid, lysol and mercury. Then contraindication of British anti-leucide, iron and cadmium, G6P deficiency, liver disease. Contraindication of physical antidote like chimps, corrosive, hydrocarbon, iron, metals, petroleum product and salicylate. Composition of universal antidote ATM, activated charcoal, tannic acid and magnesium oxide. Bedside test for cyanide, Lee-Jones test. A specific antidote for cyanide, Lilly's antidote. Acid causes coagulative necrosis except hydrofluoric acid. A strawberry tongue seen in mercury. Slate gram mucosa seen in mercury. Diphtheria like colitis seen in mercury. Basophilic stapling seen in lead. Bertollian line over the gum seen in lead. Raindrop pigmentation arsenic. Aldrich midge line over the nails beds arsenic. Symmetrical sensory neuropathy seen in arsenic. Black foot disease due to poisoning with arsenic. Most common symptoms of thallium poisoning is abdominal pain. Muscarinic feature of organophosphorus compound sludge like salivation, lacrimation, urination, diarrhea, increased GI motility, emesis. Make one sign differentiate between alcoholic coma and the coma due to morphine. Drunk and driving is punishable under 185 Motor Vehicle Act. Rape drug or club drug, mnemonic is GAIL like GHB, gamma hydroxybutyrate, amphetamine, LSD and ecstasy. Date rape drug ABCR, alcohol, barbiturate, chlorohydrate and rohypnol. Love filters or aphrodisiac poison, dhatura, alcohol, cannabis, cocaine, opium and cantharides. Differential diagnosis of metastasis ABCDE, alcohol, amphetamine, barbiturate, cocaine, cyanide, carbon monoxide, dhatura and amphetamine. Differential diagnosis of meiosis like opium, organophosphorus compound, pontine hemorrhage, benzodiazepine, carbolic acid poisoning. Father of toxicology, Paracelsus. Father of modern toxicology, Matthew Joseph Bonaventure Orfila. Hepatotoxic poison, alcohol, arsenic, chloroform, carbon tetrachloride, white phosphorus, tetracycline, erythromycin, rifampicin, isoniazide, methyl dopa and phenytoin. The poison having stupefying action, CCD like cannabis, chloroform and dhatura. Cattle poison, abrus, oleander and organophosphorus compound. Arrow poison, abrus, aconite, croton oil, calotropis, snake venom and strychnine. Indication for penicillamine, MLC, mercury, lead and copper. Indication for succimer, MLA, mercury, lead and arsenic. Composition of coma cocktail: dextrose, thiamine, naloxone and flumazenil. Poison causes failure of respiratory muscles like cobra bite, organophosphorus compound and nicotine poisoning. The poison causes failure of respiratory center. This is the failure of respiratory muscle. This is the failure of respiratory center. Opium, strychnine and alcohol. Poison causes stimulation of respiratory center. Amphetamine, atropine, salicylate and cocaine. Hallucinogen poison: LSD, alcohol, cannabis and cocaine. Poison which resist putrefaction like carbon monoxide, cyanide, organophosphorus compound, dhatura and strychnine, arsenic, mercury, lead. Hippus seen in the poison with aconite and barbiturate sometime. Nystagmus seen in the poison like ABCD, alcohol, barbiturate and carbamazepine. Barbiturate interfere dehydrogenase system. Arsenic, mercury and lead combining with SH radicals. Hydrocyanic acid inhibits cytochrome enzyme system. Organophosphorus compound inactivated acetylcholinase enzyme. Color of tooth in poisoning: chalky white in sulfuric acid, yellow color in nitric acid poisoning, black color in cocaine. Poison which leads to heat stroke like hyperpyrexia seen in dhatura. Poison which produces thyrotoxic crisis like symptoms like dinitroorthocresol. Poison which causes sex perversion or nymphomania or ceriasis, cocaine. Poison which causes depression of sexual power, chronic opium poisoning. Poison causes blister-like patches on the skin, carbon monoxide and barbiturates. Color change on gum: purple line, copper sulfate; bluish line or Bertollian line, lead poisoning; black color, cocaine. Color of stomach wall in poisoning: in mercury, slate grey mucosa; nitric acid, yellow color mucosa; oxalic acid, black color mucosa; copper sulfate, bluish green; ferrous sulfate, green; arsenic, red velvety mucosa. Poison that gets re-excreted in the stomach like arsenic, morphine, croton. Poison which causes subendocardial hemorrhage like mercury, viper bite, phosphorus, cardiac poison. Poison which causes tremors: mercury, alcohol, phosphorus, caffeine, carbon monoxide. Poison which causes production of artificial bruise: pneumonic is PSM, plumbago, semicarpus, madar, sulfuric acid. Hunan hands: it is a contact dermatitis caused by the direct handling of chili powder containing capsaicin. Poison which causes seizure like amphetamine, cocaine, theophylline, coagulated insecticides. Poison with sweetish taste like lead acetate, methyl salicylate, glycols or nitrous oxide. Carrot like smell of the poison: Conia maculata or hemlock. Mothball like smell of poison: naphthalene. Brown color hypostasis seen in potassium chlorate, nitrates, aniline and bromides. Best preservative for viscera preservation: rectified spirit. Most common preservative for viscera preservation is supersaturated solution of common salt. In cobra, third supralabial scale is larger. In kerath, fourth infralabial scale is larger. Big 4 contains common cobra, kerath, Russell viper, soy skull viper. Number of seeds as fatal dose of poison: 1 seed in Nux vomica and Abrus precatorius, 5 seeds in Croton tiglium, 10 seeds in Ricinus communis and 100 seeds in dhatura. Cannabis is also called as rope, pot, weed, marijuana, grass. Acrodynia, erythism, mercurial lentis are the feature of chronic mercury poisoning. Basophilic stippling, wrist drop and encephalopathy are the feature of lead poisoning. Phosphorus is 4P poison like protoplasmic poison, phosphijao, photoluminescence and purpura. Abrus is also called as gunchi seed, rati seed, rosary beads. Other name of opium is afim, madak, chandu. Other names of heroin is smack, junk, dope, brown sugar. Legal limit of alcohol in the India is 30 milligram per deciliter. 510 IPC punishment if any person causes public nuisance under the influence of alcohol. 328 IPC for punishment administering a poison to cause hurt. 284 IPC punishment for negligent conduct with poison. 85 IPC definition for involuntary drunkenness. 86 IPC definition for voluntary drunkenness. 90 IPC for definition for consent given under intoxication is invalid. The malt brown reflex in slit lab examination seen in the mercury poisoning. Liquid gold, the urine of the amphetamine abused person, it's called liquid gold. All acids show the cognitive necrosis except hydrofluoric acid. Flashback phenomena seen in cannabis poisoning and LSD intoxication. Angel dust or phencyclidine causes the dissociative anesthesia. Okay, this is all about toxicology. Thank you for watching.